Hannah Osborne and Jennifer Deming on Case Study Team Conference 1. For this case study, we had Mrs. Tyler. She's an 80-year-old female living in an assisted living facility. She lives near her family and enjoys visits from them, as well as watching Jeopardy in the evenings and reading murder mysteries. Currently, she's unable to do the things like gardening and taking care of various plants and cooking due to a recent diagnosis of dementia and problems with her cognition. On 9/5/2020, Mrs. Tyler experienced dizziness and fell in her bedroom while trying to adjust her walker. She was transported to the hospital, and at the ER, the doctor found that she had a fracture of the greater tuberosity. It was considered non-displaced, and there were no gross abnormalities of the elbow or shoulder joint, including the glenohumeral articulation. In this picture to the right, you can see in the blue area that this is specifically where Mrs. Tyler's fracture took place. Some of the functional limitations that we looked at as a team was Mrs. Tyler's ability to hold her book, since this is important to her and what she does in her leisure time, as well as turning on the TV to watch Jeopardy. The major concerns were self-care, like dressing, brushing her teeth, and brushing her hair, and being able to move and travel safely around the facility with the use of her walker, as she was doing prior to the accident. Since Mrs. Tyler is unable to use her right arm, which is her dominant arm, she can no longer hold her book with this hand. Her humerus is no longer functional, so lifting it above her head to do self-care tasks like brushing her teeth or brushing her hair is something that we deeply need to look at. We also want to make sure that she can safely ambulate, because she's unable to use her walker in the same ways that she was before. And we need to look at things like getting in and out of bed, getting on and off the toilet, and getting in and out of the car to be able to visit her family. We're worried about client factors such as spirituality. How will this accident affect Mrs. Tyler's feeling of control? Does she give her feeling of control up to a higher power, or does she feel that her ability to heal is in her own hands? And could occupations or occupational performance reconnect her in some way to her spirituality? And what are her body functions looking like? We know that she has a recent diagnosis of dementia, and so what is her present cognitive level on a day-to-day basis? What does her muscle function and joint mobility look like? Will she have to wear a cast? Will she be in a sling primarily after this orthopedic surgeon appointment? And what does her endurance, strength, fatigue, and stamina look like with her body structures? We're looking at both skeletal and her cardiovascular system. We're looking at the OT's role in treating Mrs. Tyler, and that would be patient and family education, some modifications in the assisted living facility so that she can function as independently as possible. This is during the time of COVID, so we need to think about some of these modifications that we can make for the family since they're unable to go in and help. We're looking at compensatory and energy conservation strategies, as well as what's the mobility use in her arm as it heals. If there are any questions, please feel free to fill it in on the discussion board. Looking forward to chatting with you guys.